Hey, good evening. I'm Jennifer Stanley from Savannah, Texas, and I'm going to be talking to you about Clostridium Difficile. So first off, what is Clostridium Difficile, or short for C Diff? And you may have heard that more than the long term that we hear. So C Diff is actually a gram-positive bacilla or bacillus. It is a spore-forming anaerobic bacteria. It's very hardy spore, and it's a vegetative state, so it likes to get down in there and just veg out and just sit around and stay where it doesn't belong. Where that goes is into your intestines, and we'll get into that in a little bit. So with C. diff, since 2002, the incidence of it has increased drastically. They have found some newer strains since then, and its toxicity is 15 to 20 times more potent than previous strains. So it's a pretty nasty bug. And like I said, it gets down into your intestines and causes diarrhea, watery stools, and lots of not fun stuff. It's part of your normal flora, and sometimes whenever you take an antibiotic that should be good for you, it actually almost does the opposite, and it gets rid of that normal flora that's in your intestines and washes it out, and that turns into the C. diff. And so from 2009 to 2013, Medicare did a study, and they studied 86,000 patients that were admitted to the hospitals for C. diff. And of those 86,000 people, between 2009 and 2013, they said that 8,000 people were readmitted to the hospital, which means that they came back within 30 days of leaving the hospital. So 8,000 people, that's 10%. That's a huge number. So why? What's so big about this C. diff? So we'll get into that. So clinical manifestations, or some of the signs and symptoms that someone may come in with it. Loose, watery stools, like I said earlier. And it's not just a loose, watery stool one time. It's about at least 3 times in a day. And it also might be accompanied by fever, some abdominal cramps, which are not normal abdominal cramps. They're just real tight abdominal cramps. May have a loss of appetite, and there might be blood and mucus in the stool as well. And sometimes all of that and several bouts of the diarrhea causes a person to be dehydrated. And some of the symptoms with dehydration could be dry mouth, dark urine, cracked lips, real tired. And when you're dehydrated, it depletes everything. And so when you're having diarrhea, you're losing a lot of your electrolytes. So it's caused the dehydration. So who's at risk for getting C. diff? Well, anybody's at risk. Yeah, even you and I are at risk. But you have a more chance of being at risk if you're over 65 years old, if you have multiple comorbidities, which is other disease processes that you have going on. Also, if you've been on any antibiotic therapy within especially the last 30 days, you have more of a risk. Also, if you're on any proton pump inhibitors or PPIs, which would be like a Prilosec, that's over the counter, or Nexium or Protonics. Those are things to help with your esophagus, and that's a totally different story. So also, if you or someone has a history of having C. diff, they're more at risk of getting it again. And if they've had a prior hospitalization for anything, because of the way that it spreads, they're more at risk. It's a fecal-oral route is how it's spread. Contact to contact. It's a pretty nasty bug. So some of the diagnostic tests that they do is they may take a stool sample and send it off to the lab for testing. Different tests that they have is an enzyme immunoassay, PCR, colonoscopy. So the enzyme immunoassay, it checks for the toxin A and toxin B of the C. diff. Toxin A is actually an enterotoxin, and that is what causes the diarrhea. And then the toxin B is cytotoxic, and it's also cytotoxic to the colonic cells or in the colon, and to the cells in there. And so that's the toxin A and B. And then with the colonoscopy, when they're looking at that, they're looking for any arrhythmia or inflamed, swollen areas in the intestines, really lower part in the colon. And that's your body's immune response to that nasty bug getting in there. And so the treatment for Clostridium Difficile is flagyl by IV or by mouth, or metronidazole. Said it right. So if they give it to you by IV, they'll give you about 500 milligrams 3 times a day for 10 to 14 days. Yeah, you'd probably be in the hospital that whole time. If you get it by mouth, then they usually will give it to you a couple of days in the hospital and send you home with it. And it's also 500 milligrams 3 times a day for 10 to 14 days. Now with the IV flagyl, they also need to give you vancomycin by mouth, and that's a really strong antibiotic. And so when you get the vancomycin by mouth, you're going to take 125 milligrams 4 times a day for 10 days. So you're going to be taking 1 for 3 times a day and 1 for 4 times a day. So they're pretty strong in attacking that. The vancomycin, they don't like to give that by IV because it is not absorbed. It doesn't even go to the intestinal tract. With the by mouth vancomycin, it's absorbed in the GI tract and it just sits there at the site of infection. So that's good. And the doctor's going to tell you not to take anything for anti-diarrhea. So don't take anything to stop the diarrhea. You've got to let it run its course. And so what are ways to prevent the C. diff? Well, wash your hands. Anytime you're in contact with anybody that has it, always make sure that you wash your hands with soap and water, friction, rub it vigorously for, I don't know what they say, 30 seconds, or the ABC song. Also, like I said, wash your hands anytime, of course, after you go to the restroom or anytime you're touching somebody that has that. Also, clean everything that comes into contact with that person. If you're in the hospital or, say, you're in the healthcare industry, then you're going to want to wear gloves, but wash your hands with soap and water before and after you're with the person. And anything that comes into contact, the hospital bed, your stethoscope, the thermometer, the blood pressure cup, anything, you just need to wash it down. And it's real easy to spread this. Alcohol sanitizer is not good. It does not kill this C. diff bug. So yeah, you've got to do soap and water, vigorously wash them. And then if they're in the hospital, they'll put them in contact isolations as well. So outcomes of it. So like I said, the antibiotics do really well. And however, 40% of the people that get C. diff have a chance of it recurring. So yeah, it's 40%. It's a large number. Also, like I said earlier, those 8,000 of 86,000 people that came back to the hospital in 30 days, 58% of those returned to the hospital within the first 25 days. So they have a higher risk of coming back. And a lot of it is people that don't finish taking their antibiotics. They go home, think they feel better, and don't take them. Well, then that causes the superbugs. And that's what ends up really causing a lot of C. diff. Also with the C. diff, it's caused by, another reason that it's caused is because people take so many antibiotics, and you get a cold or something, you go to the doctor, they give you an antibiotic. Well, cephalosporins, broad spectrum penicillin, ampicillin, those are all in these families that have a greater risk of giving you C. diff. So you always want to watch that, and the doctors should be well aware not to just prescribe antibiotics to anybody, because you have a higher chance of catching this nasty bug that gives you diarrhea for days. Anyway, that's my presentation. So thanks. Have a good evening.